My name is Dr. Gerry Trinidad. I'm an orthopedic surgeon at UK King's Daughters Medical Center. We've had the Mako here in Portsmouth, I think around a little over 3 years now. Since we've had the Mako, it's been a complete game changer in knee replacement surgery. We're at 500 Mako procedures now, and we've had incredible, excellent outcomes and results. When we use the Mako, so we preserve bone, we preserve soft tissue, and those are the sources of pain. And by limiting that, people just do better, they have less pain, and they rehab quicker. We are very excited to now have the Mako for total hip replacement surgery as well. I do direct anterior approach to total hip replacement surgery. Direct anterior hip replacement has a very low incidence of dislocation. By combining it with the robot, the analytics that we see, the numbers that we see when putting these implants, we're able to recreate the what we call the offset. And again, we're able to get those implants in specific for that patient, regardless of their anatomy and position of their pelvis specifically. The accuracy, the reproducibility that we have with the aid of the Mako is just amazing. Again, it's been a complete game changer.